All right. Hello, everyone. Thank you for joining us for a quick briefing here on what's happening with our COVID-19 response. John Peacock, County Manager. I think all of you probably know me by now. At any rate, as you all have probably heard at this point, 10 out of 10 tests that were conducted on Australian visitors here in Pickens County did come back positive or presumptive positive for the COVID-19 virus. There has been additional testing conducted. We have not received the results of that testing and expect to in the next 24 to 48 hours. However, the results of the testing have caused us to change our strategy from one where we felt that we had an opportunity to contain the spread of the virus to one where we are assuming that there is community transmission now. And so what that means is that we are changing our strategy to more social distancing strategies. All departments through your section leaders received instructions earlier this week as far as how we are going to respond as county departments. I'm just going to review that quickly so that everyone knows what that general direction is. First, all county departments should cancel all non-mandatory meetings or public gatherings. Many of you have probably seen those cancellations. They were to start yesterday. We will be reevaluating this directive on April 15th, but from now through April 15th, we will be canceling all non-mandated public meetings and gatherings. This is especially true for any event or gatherings that would involve at-risk populations. We also are encouraging departments that can to implement telework opportunities and limiting all non-mandated public access to departments. Social distancing from strategies from front desks and service areas should be implemented. What that means is we're looking for 6 feet or more of separation between members of the public and employees. This may include queuing space, changing waiting area seating where possible, pushing electronic access to services where possible, or creating barriers between service desks and our customers. Again, this is for the protection both of our employees and our public. As of yesterday, travel for all county employees to conferences or trainings that involve gatherings of 50 people or more will be canceled through April 15th. Again, this will be reevaluated as the COVID-19 situation evolves. Any exceptions to this travel ban need to be approved through my office. Pool vehicles will no longer be available for scheduling through April 15th, but will be assigned to specific departments. Vehicles will be disinfected prior to assignment. We're also encouraging continued employee and public messaging of ways to avoid the COVID-19 infections. You should see posters all over county facilities right now encouraging you to stay home when you're sick or feeling sick, coughing, sneezing etiquette, and hand washing hygiene. We need everyone to wash their hands and use hand sanitizer as often as you can. When washing your hands, wash your hands with soap and water for at least 20 seconds. For those of you that get bored counting that high, sing happy birthday twice, or another song that you know is 20 seconds or longer. The county has been pre-ordering and we have adequate stocks right now of hand sanitizer and wipes, please, on a regular basis, clean hard surfaces, your work surfaces in front of you, particularly work surfaces that have exposure to the public. Do not cough into your hands or sneeze into your hands. If you can, cough or sneeze into a tissue and dispose of it, or cough or sneeze, if you don't have a tissue, into the crick of your elbow. For those of you that find this situation particularly stressful, like a lot of our public is right now, I'd remind you that we do have employee assistance program services. You can access those at www.triadeap.com or by calling 877-679-1100. Times like this, it's stressful not only to be hearing the news, but oftentimes yourself or those around you are also caretaking for children or potentially other members of the vulnerable population, which is adding to your stress. Please, please do not hesitate to utilize this resource to help with resiliency and coping. And then any employees needing any special accommodations or who wish to access telecommuting options, you need to work through your manager or supervisor to have those approved. And in a moment, we'll turn to Rich for more information on that. There are a lot of questions out there, and this has been a really fluid situation where information has been changing on a daily basis. As an employee, we know that you have a lot of questions and are looking for a lot of answers. On the PCIN, you can find a frequently asked questions document where we've been collecting questions from employees and answering them to the best of our ability. If you have a question, take a look there. You may not be the first one to ask it, and you can find the answer. If you do not find your question or the answer to your question, please contact Pat Bingham so we can add it to that FAQ document and share that question and answer with everyone. You can also find information on remote work support on the intranet, and also general information on COVID-19 and what you can do to prevent infection. I'm going to turn to Rich just to give an update on other internal kinds of measures that we're taking, and then I'll close with a general update on what we're doing in the community.
Good. Thank you, John. Rich Engelhardt, Deputy County Manager, and you would notice that John and I are doing this 6-foot distance here, so we are taking this at heart, and we ask that everybody else does. In fact, our E-team meeting this morning, we were spread all over this room. So. But with that, as you know, John has sent out a directive in how we as an organization are to react. He has asked the department heads to take it upon themselves to address how they're going to be external facing and how that's going to be managed. But I want to talk a little bit about the internal side and how we're handling that. So this really kind of focuses on HR, beds, facilities, and then finance. But just generally speaking, we have, from an internal service standpoint, we're getting down to the kind of the essential services and are going to somewhat skeleton crews. But we right now are going to have personnel in each of our offices. It may be limited, but as we stand right now, we're going to have face contact in each of those offices. But from an HR standpoint, I just want to go through a couple of things that we're getting a number of questions on, just so that you're aware of it, and just to reiterate. So. If you're experiencing flu-like symptoms or you're sick, stay home. Ensure that you're in contact with your manager. Your manager, in turn, will notify your respective HR business partner who will contact you with reference to leave management processing. Remember that you will be paid for those first 80 hours under our temporary policy change that you should be familiar with now. That does bridge that waiting gap to be able to get to short-term disability for consideration. Secondly, based on the CDC guidelines, employees who identify themselves as high risk or who are caregivers to someone considered high risk may consult with their supervisors on the remote work option. If remote work is not an option, employees will be paid, again, that 80 hours under our temporary policy change. So employees need additional paid time off beyond the 80 hours. They can use accrued paid time off that they have built up. And then thirdly, if none of these two options or alternatives apply to you, speak with your manager about remote work or requesting time off, where you can use accrued comp time. We ask you to use comp time first, and then paid time off can be used. So again, it's just staying in touch with your direct supervisor so we can get you that information. From HR's perspective, though, I just want to mention that due to the changes in what we're doing, they've kind of identified their essential functions, and those are leave management, which is working with short-term disability, workers' comp, and FMLA, staffing and recruitment functions, Munis, HRS, employee status changes. We're in that process of that conversion, employee benefit management, and then employee relations and well-being. So other things are considered non-essential at this point in time. So please keep that in mind. As far as BETS goes, again, limited staff on site, but Melissa Jodis has provided me a list of all those that have reached out to her and communicated about the need of laptops. And we're in good shape there. We're continuing to work through the remote access for the VPNs, and if you're having challenges with that, we have provided on PCI in a toolkit to go through to try to clear your cache to make that work more effectively. If it's still not working, I ask you to continue to reach out to the help desk, and please CC Melissa as you do that as well, so that we're covering all bases and we can get our help to you as quick as possible. We have added 2 more go-to meeting lines, and we're expanding our services and looking at ways of testing Google and Zoom capability for meetings, so those are forthcoming as well. As far as facility goes, talking with Jody and Mike, as you can imagine, a lot of demand on them right now, and John just hit on it about cleaning and taking kind of responsibility for your own workstations. Mike and Jody have both mentioned if you need some gloving, the gloves, nitro gloves, that they can provide those for you and additional products. But if you could help our facility staff and kind of taking the time to clean up your areas, that would be just greatly appreciated. From a finance standpoint, I guess the biggest key too right now with all the people working remotely is that you go through and get your timesheets done early and get those approved so that we can make sure that your VPN, well, actually it'll just be through internet. You don't need the VPN to do that. But those are working properly, because I'd hate to last minute have a bunch of employees that aren't able to get through. So I would encourage you to do that as soon as you can so we can get those approved, just to make sure that it's going through properly. And then the last thing is, one of the challenges that you have in situations like these when there's a lot of organizational change is cybersecurity becomes an important need for us. If our system happened to be compromised where email was no longer available to communicate, we have the ability to do it through Pitkin Alert. And we have just to set up a group of just county employees that we can send a Pitkin Alert to communicate to you through. And we want to just test that. Brett, Valerie, myself, and Bits are going to be working on that. I'll get with Pat on the communication, but it's not to instill panic, please. I know that. It's just testing our system. So last resort, if things go down and email's not working, it'll be a way for us to communicate to all employees. So that'll be coming here pretty soon, but just wanted to give you a heads up on that. But other than that, I just want to thank everybody. I want to thank the leadership team, and again, John, your leadership, and our BOCC, and how we have reacted to this. I think we've put policies in place that have put us in front of this, so it's very much appreciated, and it's because of your support and the way that you're also professionally handling this, so thank you for that. So, John?
Yeah, thanks, Rich. So, few updates on what's going on in the community. You probably saw in the paper today that last night, Pickens County Public Health issued a public health order limiting events and gatherings. I think it is safe to say this is one of the most aggressive, if not the most aggressive order of its kind in the nation. It's one that was coordinated with Eagle County and Garfield County, and we are hopeful that Gunnison and Summit will adopt something similar, if not the same order today. Under this public health order, all events of 50 people or more are prohibited. Events with fewer than 50 attendees are prohibited unless event organizers take the following steps to mitigate risk. Older adults and individuals with underlying medical conditions that are at increased risk of serious COVID-19 are encouraged not to attend, including employees of the event organizer. Social distancing recommendations are met. These include limiting contact of people within 6 feet from each other than for 10 minutes or longer, and any other applicable guidance that is further in the health order. And then any employees of an event or gathering organizer must be screened for coronavirus symptoms each day and excluded if symptomatic. This obviously will have a significant impact on our community and on our own operations as we consider if and how we can meet these guidelines for events with or gatherings with fewer than 50 people. If we are unable to meet these requirements, we will need to be canceling those events or gatherings, even if they are public meetings. Why are we doing this? The goal here is really to flatten out the growth of the COVID-19 virus spreading in our community. We've made a determination that now that this is community spread, not isolated to an identified population, that our best strategy is to limit the spread of the virus so that it doesn't peak and overwhelm our medical system and first responders. To that end, our best strategies right now are social distancing strategies as well as the hygiene strategies that we've outlined for you. I know we've had a lot of questions about screening and testing and the change in that protocol. When we're in using the strategy of hopefully isolating the virus to a known population of potentially infected individuals, our screening and testing protocol was really geared towards identifying folks who had contact with someone who is infected, testing them, and then isolating or quarantining them as appropriate. However, with the community-based spread of the virus, where we cannot necessarily identify everyone who has it, we've reevaluated our strategy for broad-based community testing. Our goal now is to ensure that the high-risk populations are being screened as needed to ensure we can prevent mortality and maintain a strong first responder infrastructure so that they can continue to serve our community. Those, including you, who exhibit flu-like symptoms, fever, cough, or shortness of breath, are encouraged, and in fact, as a Pickens County employee, directed to stay home until symptoms subside so others are not exposed. You should see your primary care physician. You should be calling your primary care physician first if you're exhibiting these symptoms and getting instructions from your healthcare provider about how to proceed. So that is really the explanation for the change in the screening and testing protocols. If you were wondering about it as a Pickens County employee, or if you're getting questions about it. Obviously, over the next week, we'll be evaluating county operations and gatherings in light of the public health order, and we'll be making adjustments as appropriate to meet this new strategy to flatten the curve and slow the spread of the COVID-19 virus, both in our community and our organization. As always, our priority remains both our employees' health and safety, as well as maintaining our ability to serve our public. So thank you very much.
One last thing.
And Rich has one last thing before I sign off.
I'm sorry, it's like a radio call-in show.
Yep.
So Pat Bingham had just sent me a text asking the departments on your web pages that if you have those, if you could update those for us. And then also, if you are in the building and you're feeling ill and you need a place to go, we've set aside the downstairs shower room for that opportunity. It's a direct outlet to the outside, so if you're securing a ride rather than hopping on a bus, we would ask that you use that room in particular to kind of get yourself set up, get your ride here delivered if you need that. So that's available for you as well. So with that, John, I'm sorry.
No, thanks, Rich. And so just in closing, this is a big impact on our day-to-day routines at work, our day-to-day routines in our lives. We have the dual role of supporting, or I guess the multiple roles of supporting our families, supporting the public, and supporting ourselves. As an employer, we're here to support you. We will get through this, and we will get through this eventually with flying colors, I'm quite sure. So I just want to thank you. I know a lot of employees are taking on roles and responsibilities outside of your normal day-to-day work. Thank you for that. It's likely to continue for a little while. This is what public service is about, and I continue to be proud to be part of this organization and work with great public servants like you. Thank you. Are we off?